Hi, welcome to another knee moment from Knee Fit and 5 and MSM Products. My name is Dr. Matt Lawless.
And I'm Scott Johnson, physical therapist.
Sarah writes into us and she's asking, I am scheduled for a total knee replacement and I was wondering what I will need afterwards as far as starting to walk again. Will I need a cane? Will I need a walker? Will I be on crutches? Please help. Scott, what do you think?
Well, what I usually teach my patients in the preoperative education class is that most of the patients will start off with a walker. You can either use a walker or you can use crutches, whatever you feel the safest with, but most of the patients that I work with feel safer with a walker. Usually the next question is what are my thoughts on a standard walker versus a walker that has wheels on the front of it? The one thing I want to emphasize is that you can practice in the hospital with whatever you feel most comfortable with, but what I really prefer is a front-wheeled walker. The reason I like front-wheeled walkers is that it allows you to walk with a nice smooth gait pattern again. I don't really have problems with standard walkers, but in order to walk with a standard walker, you have to pick the walker up, take your steps, pick the walker up, take your steps. And if you feel comfortable doing that and you want to do that, that's fine. But if I can teach my patients to stand up nice and tall and just walk with one foot after the other with a nice smooth gait pattern, that's what I'd rather do. You know, if you have a bad back, if you have a bad neck, if you have a bad shoulder, picking that walker up and setting it forward with every step that you take just irritates those structures. So in my opinion, you keep the walker on the ground, you stand up nice and tall, and you just walk. My next question is always, well, when do I advance away from the walker? And my answer to that is usually people will progress from a walker to a single tip cane to nothing. And so when do you transfer to that single tip cane? And my answer usually is when you can do that with a nice smooth gait pattern or when you're walking nice and smooth. If you're hobbling on a cane, you're probably not ready for a cane. But if you can walk and that cane's there just to provide that little bit of support that you need, then you're ready to transition to the cane. And then eventually you'll find that you can walk nice and smooth without the cane and you can go and enjoy your life.
Good. That's very interesting and I agree completely. I do think that almost all of my patients need a walker. It's just easier to use than crutches and it seems to go much smoother. The other thing you mentioned was when to transition, and I completely agree. You need to use whatever it takes not to limp. So use a walker till you can walk smoothly with a cane and then transition to a cane. But
yeah,
yes,
absolutely.
Good input. Thank you.
You're welcome.
Susan, I hope that helps.